What does long-distance travel, family health history, and body anatomy have in common? Well, it may be unexpected to hear these words in the same sentence, but they do share a common risk link. Joining us now is Bernie McKay and his physician, Dr. Kush Desai, with Northwestern Memorial Hospital in Chicago, to discuss what you need to know about this surprising connection. Doctor, what is the health risk that links together long-distance travel, family health history, and body anatomy?
Those factors are linked by a disease process called deep venous thrombosis. And in deep venous thrombosis, what happens is a clot forms inside the deep veins of your legs, and it can result in symptoms such as significant swelling or significant pain. And the real concern with DVT in the short term is that the clot can break off and travel to your lungs, causing something called a pulmonary embolism, which can be a potentially deadly event.
Bernie, could you tell us about the DVT symptoms you experienced and your diagnosis?
Yeah, absolutely. Well, as a husband and father of two with two very active and lively dogs, I've kind of prided myself as someone who lives an active lifestyle. So I experienced a sudden and intense cramping sensation in my left hamstring while walking to work, just on a normal walk. And at that time, I knew right away something was wrong. So fortunately, I work at a hospital here in Chicago, and as I continued my walk, the pain did increase, and I literally limped into work and then eventually into the emergency department. In the emergency department, they did perform something called a Doppler ultrasound to just kind of look at the blood flow in the leg, but unfortunately that study did not show any abnormalities, so I was given instructions just to follow up with a specialist, which I did that following day. By the following day, though, the leg did continue to swell, and the pain did increase to the point where once I saw the specialist, they did diagnose me with a DVT caused by Thurner syndrome, which is an anatomical variation that I have.
Doctor, what puts someone at an increased risk for DVT?
There's a lot of factors that can put someone at an increased risk for DVT. The ones that most people have heard of or are aware of are long-distance travel. So long plane rides or long car rides can certainly put someone at an increased risk of DVT. It's no surprise that you can be on a long plane ride and flip to the back of the in-flight magazine and you'll see DVT exercises. So certainly the perception and the awareness of this risk factor is widespread. But there are many other risk factors as well. Prior hospitalization or recent hospitalization, more accurately, can increase the risk of DVT. So can a recent surgery. Being overweight can increase your risk, and being over the age of 55 can increase your risk as well. So those are just some of the risk factors. And then, of course, there's the anatomic variation that Bernie referred to. In Thurner syndrome, what happens is the artery in your pelvis compresses the vein, your left iliac vein, and when that vein gets compressed, the drainage of blood from your leg slows down and potentially clots.
Bernie, how has your life been affected?
Well, since the onset of this event and the procedure, I actually have returned back to a normal lifestyle. Originally, I was told that they would treat the blood clot as they would actually admit me into the intensive care unit and administer some pretty powerful blood thinners to dissolve the clot. But Dr. Desai had explained to me a minimally invasive procedure called a thrombectomy, where he could go in and mechanically dissolve and remove that clot in a single procedure, eliminating the need for me to go into intensive care for multiple days. So I'm back to normal. After that procedure, I was released from the hospital the next day and continued my normal activities, and probably more active now than I was prior to the incident.
Doctor, is there anything you'd like to add about DVT?
Well, I think it's something that we're working on building awareness throughout the medical community and as well as in patients in general, because it really does affect a very widespread cross-section of patients. There's the risk factors we talked about, but it can affect a wide variety of ages. I've certainly treated patients that are young and patients that are elderly too. So I think an understanding and being attuned to your body is important. If you notice something out of the ordinary, it's important to first go and seek the attention of your physician. Your physician is the most important person to direct your health care, and they can help diagnose what's going on with you. There's other resources available, and one of the resources available is a website created in partnership with Boston Scientific called clearingtheclot.com, and it's probably one of the great resources for DVT on the internet. This is a resource that patients can go to find information about the disease process, their options for treatment, and it's something that they can also refer their physicians to. So clearingtheclot.com is one of the better resources out there that can help patients, and it's also available on Facebook.
I'd like to thank you both for taking the time to talk with us today. Have a good day.
Thank you.
You're welcome.